Alright, what is going on, FTF family? So let's talk about a little bit of recovery, okay? So I'm gonna obviously use Nikki as my demo right now, okay? But for a lot of you guys that are having sciatica issues and things like that, here, I'm gonna show you how to use obviously the massage gun. Let's roll to your side facing the camera for me, okay? So that way they can see your pain.
Yay!
Alright, so if you guys have the massage gun, okay, this is kind of what I would recommend. I actually done this with a few of you guys in the gym too as well. We are going to be hitting the IT band, okay? So if you guys see, obviously we have right here, which is just a side, you have the quad. Right in between is the IT band, okay? So this is where a lot of you guys feel a lot of pain in the knee when you're running, walking, squatting, or lunging, or anything like that, okay? So if you have a massage gun, you can get the hubby or someone at home or the kids to kind of give you guys pressure on this. I'll show you what we can do, okay? So it's going to be active release treatment in a sense, okay? So you can turn on the massage gun, you can put it really low as you need to, all right? You can tell the person on the ground to relax. All right, and what you really want to do is you want to kind of just work along the line like so, okay? You really want to try to find, you okay down there? You want to try to find a few different hot spots, okay? So for example, all right, if Nikki's having knee pains, I'll just start like the muscle group inside, okay? So if you start right here, roll up right here, and then have her bend, okay, to your hip, okay? So bend, 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 straighten out, relax, good, work your way up, okay? Bend, 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 straighten it out, okay? Once again, bend, 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 straight it out, okay? Here comes our baby coming to attack. All right, she's fine. All right, here we go. Bend, 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 okay? And what obviously Nikki's feeling right now is we're working on IT band, so every time she bends, okay, we work it, she releases, you can lift up, okay? Find a hot spot again,
Yay,
okay? Bend, straighten out, release, okay? Once again, bend, 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 straighten out, release, okay? So right now, we're working on her whole entire IT band like so, okay? So basically, you'll do this a couple bends. By the time you work your way up, you should hit at least 15 to 20 bends, okay? And then you want to do the opposite side too as well, okay? Another thing to do is the glutes, all right? Same exact thing, okay? Once again, they can bend, okay? You're finding the pocket here, and then you're having her bend all the way out to hit a hot spot right here, okay? Find a hot spot, hit all the way out, okay? So a lot of this stuff, you're doing 20 passes, finding a hot spot here, okay? Pushing the knee all the way out, so that way one can activate the glutes, okay? So that is what you're gonna do to kind of work on the IT band to minimize knee pain, okay? So as you stand up, you should feel a lot looser in the knees. How do you feel?
Much better.
Cool beans for shizzle. All right, cool. Boom. Appreciate you. If you guys have any other questions, post in the Facebook group.